Now, after the discussion on hypothyroidism, let's look at the other end of the spectrum of the same gland, the disorder called as hyperthyroidism, wherein there is excess of thyroid hormones. Now, this excess of thyroid hormones is because of overactive thyroid gland. That could be because of genetic reasons or acquired reasons. Now, this overactive thyroid gland is producing too much of thyroid hormones, that is giving rise to symptoms like lack of or disturbed sleep. You could be experiencing sudden weight loss, palpitations, increased sweating, and you feel hot all the time. There could be tremors. Your muscle weakness is also experienced, and brittling of bones is also experienced because of decreased bone density, which will make you susceptible to fractures more easily. And as per skin and nails, a lot of patients complain of thinning of the skin and brittle nails as well. And there is also thin brittle hair that one experiences in cases of hyperthyroidism. While in hyperthyroidism you could experience hair thinning, hair loss, but with hyperthyroidism, along with hair loss, the most obvious symptom with hair is like you feel that your hair has become weak, it's thin and it's more brittle. So there is brittle nails, brittle hair and skin thinning, along with all the other symptoms with weight loss. So now let's look at the foods that you can eat and foods that you should be avoiding in hyperthyroidism. Now, this goes hand in hand with the medical line of treatment that is being given to you. Food alone is not the solution. Of course, eating right is an adjuvant, like I've already mentioned in the previous video. Food is a good adjuvant to the medical line of treatment and other therapies like your exercise, mindful and clean eating. So eating right goes hand in hand with the other line of treatment depending on your hormone levels. Now, with hyperthyroidism, certain foods that are contraindicated in hypothyroidism can be eaten here. So foods like cruciferous vegetables can be consumed in case of hyperthyroid patients. Now, cruciferous vegetables include bok choy, broccolis, Brussels sprouts, cauliflower, cabbage, kale and bamboo shoots. So these are the foods that will reduce the production of thyroid hormones by the thyroid gland. So these are vegetables that you should be including in your diet. The next category is foods low in iodine. Now, because iodine directly stimulates the thyroid gland to produce more thyroid hormones, you should be looking into foods that have low iodine content in them. So you should be looking into non-iodized salt, coffee or tea without milk or dairy or any soy based products, again because soy is again contraindicated in this condition as well. So look into tea or coffees that are made without dairy or without soy milk. So you could probably be looking into coconut milk, almond milk as a replacement. Again, low iodine foods are egg whites, potatoes, honey, oats. So these are the foods that you could be including in your diet that are low in iodine content. So when it comes to nutrients, we have also discussed in hypothyroid patients how selenium is very important. Selenium is still important even with hyperthyroidism because it also has a role in protecting the thyroid gland, as we discussed, right? It also has a good antioxidant activity which will protect the gland from free radical damage. So moderation of selenium rich foods is again important in case of hyperthyroid patients. Again, discuss with your doctor depending on the level of your thyroid hormones. So the foods that are rich with selenium include Brazil nuts, chia seeds, mushrooms, sunflower seeds, and you could also be looking at supplementation, but again go with your doctor's advice depending on your thyroid hormone levels. Other vitamins and minerals you should be looking into are iron, and the sources rich with iron are dried beans, lentils, nuts, poultry produce, seeds and whole grains. So the other nutrient that you should be looking into is zinc. Now, zinc is a source of energy that will also help in maintaining your immune system. So the food sources rich with zinc are beef, cashews, mushrooms, pumpkin seeds, and you could also be looking at zinc supplementation as per your doctor's advice if you're not able to get enough zinc through your dietary sources. Now, the other supplementations will include your calcium and vitamin D supplementations, because as we've discussed, thyroid glands can also have thyroid hormones can also have effect on your bones. It can make your bones brittle by decreasing the mineral density. Vitamin D and calcium supplementation will help in strengthening your bones depending on your hormone levels. Discuss with your doctor and include vitamin D and calcium supplementations in your lifestyle. You should also be looking into healthy fats. Now, these healthy fats will improve your immune system, will improve the way your thyroid gland functions. So look into oils like flaxseed oil, olive oil, sunflower oils, avocados and unsalted nuts and seeds, because try and avoid iodized salts again. So look into unsalted nuts and seeds and all of the oils that I've just mentioned. So the other ingredients you should be looking to increase in your diet from your kitchen are the turmeric, black pepper and green chilies. Now they don't just add flavor to your food, they are also excellent antioxidants and antibacterials. They also help in improving your immunity, especially in autoimmune disorders, certain autoimmune disorders and certain hormone imbalance conditions. So they will also help in overall health of your body. So look into increasing just by a little bit turmeric, and add black pepper into your salads, into your soups, and a little bit of green chilies, not just for the flavor but also for the health. Fish, seaweed, crabs, iodized salt, these are the things that are rich with iodine and you should be staying away from. The other sources that are rich in iodine also are like milk, dairy, cheese, egg yolks, iodized water, and iodine is also present in certain artificial food colorings, so try to stay away from anything that has iodine in its ingredients. Optimize the amount of iodine you are consuming, because again completely avoiding iodine will cause hypothyroidism in certain cases. So talk to your doctor and consume the optimum amounts of iodine you're supposed to be consuming. The other group called nitrates will cause increased absorption of iodine by the thyroid gland, so try and avoid or consume foods in moderation that has nitrates. Now certain foods like celery, lettuce, beets, spinach, parsley, cabbage, certain cruciferous vegetables also have this. That is why moderation of cruciferous vegetables, hyper or hypothyroid, is very, very important. Moderate the number of servings you have as per your doctor's recommendation. So gluten again is a little controversial ingredient, because gluten causes other inflammatory conditions like celiac disease, and it is an autoimmune disorder. Usually a person suffering with autoimmune disorders have high chance of inflammation and unrest in the body. So when you have thyroid disorder, consuming too much of gluten can cause inflammation and unrest even in your thyroid gland. So it's best to avoid gluten, especially if you know that you have gluten sensitivity, and if you also have other inflammatory disorders going within the system. So you can avoid foods that contain gluten like wheat, barley, malt, rye. So any of the even processed foods that mentions gluten, try and avoid anything that has gluten in it, in order to just maintain the optimum health of your body and to avoid inflammation within the system. Soy, now we've discussed soy is not good for hypothyroidism because it interferes at different levels of the thyroid gland functioning. But why is it not good with hypothyroid? Because it has some of the studies show that soy also interferes with the medication given to thyroid patients. So now, though thyroid doesn't affect or doesn't increase the production of thyroid hormones by the thyroid gland, it could interfere with the medications given to thyroid patients. So try and avoid soy and soy products. So do not consume soy milk, soy sauce or tofus and soy based creamers or any other artificial drinks that says it has soy. Now caffeine, again you could probably consume in moderation, because caffeine, tea and beverages that helps in stimulation or stimulants to your nervous system can exacerbate the symptoms like anxiety, nervousness, palpitations and so on. So depending on your hormone levels, also depending on the symptoms that you're presenting with, caffeine is a controversial ingredient. You could avoid it. You should avoid it if you have symptoms like anxiousness, restlessness, palpitations, disturbed sleep and so on. But if you do not have the presentation of these symptoms, you could consume caffeine, but with alternate sources of milk like almond milk and coconut milk, avoiding dairy and soy milk in moderation. So let's get to the takeaways. Now hyper or hypothyroid, the foods that you should be consuming in moderation are cruciferous vegetables. If you have extreme symptoms of hypothyroidism, cruciferous vegetables are a strict no-no. But if you have very mild hypothyroidism and mild hyperthyroidism, cruciferous vegetables are to be consumed in moderation, because they have many other various health benefits. So completely avoiding them might cause to some micronutrient deficiencies. So consuming them in moderation is the key. Soy milk, hyper or hypo, it's a strict no-no. Gluten, hyper or hypo, again try and avoid consuming gluten, with or without glucose intolerance, with or without other autoimmune disorders, just so that your body is not in an inflammatory state. Hyper or hyperthyroidism, you should be looking into supplements or food that are rich in sources like selenium and zinc. And if you have hyperthyroidism, look at vitamin D and calcium supplementation. Iodine, if you are hyperthyroid, look into iodized salts or other foods that can be good source of iodine. And if you are hyperthyroid, try and avoid anything that has iodine in it. But again, decreased amounts of iodine or excess amounts of iodine can cause thyroid problems. So moderation is the key. Talk to your doctor, get the right amount of doses of various nutrients, right kind of food you should be eating with a proper diet plan. So I hope this information has helped you guys, and in case you have any more queries, you can reach to us on info@dnskinclinic.in or on our social media handles. Until then, you guys stay healthy, stay happy, and a happy nutrition week.